Hi everyone. Today for our project, we'll be focusing on spina bifida. Now, just to give a quick overview of what this is, spina bifida is a type of neural tube defect in which there's a failure to fully form the neural tube to varying degrees. In more severe cases, it can usually be identified before or right after birth, with the capability to happen anywhere along the spinal cord. The name spina bifida is usually associated with its more severe form, where it presents as a sac of cerebrospinal fluid that is encased within a stretched out sac. This sac then protrudes from the individual's back, as it can be seen in the lower part of the diagram. Though this is what most people think of when they hear spina bifida, there's actually three classifications present. The first here is called spina bifida occulta. This is the most mild and also most common form of this disorder. When this happens, there's a small gap present in the spine, but no visible sac is present along the individual's back. Because of this, there's usually no observed spinal cord or nerve damage, allowing for almost no disability to be evident. Most individuals will actually go through their late teens and even adulthood without knowing that they have this. The only symptom that may indicate that they have spina bifida occulta in these people would be kind of like a small hairy patch or dimple present along the side of the defect. The second type is called a meningocele. This form of spina bifida is slightly more serious. Here, there is a visible sac present along the spinal cord, and it is filled with spinal fluid, but the spinal cord is not actually present within the sac. Because of this, the nerves stay relatively safe from damage. The individual may have slightly weakened leg or back muscles, but overall will have little to no disability. The third type is also the most severe, and it's called myelomeningocele, or also aperta spina bifida. This is when not only is there a sac of cerebrospinal fluid that protrudes from the individual's back, but there's also the underdeveloped spinal cord that gets pulled into the sac, and this kind of leads to a lot of nerve damage. It's very common for children with this form of spina bifida to have issues with like paralysis in the lower limbs and also trouble with bladder and bowel control. Common comorbidities often include hydrocephalus, which is a buildup of cerebrospinal fluid along the brain, which in turn leads to like seizures and brain damage. Because of the nerve damage present, individuals may also need things such as walking aids, braces, and or wheelchairs to function in life.
So for causes, while we aren't entirely sure, it's thought to be a combination of genetic and environmental factors coupled with poor nutrition. There's four main categories of risk factors. The first is a family history of spina bifida, which is thought to be the strongest risk factor. Second is insufficient intake of folate or folic acid. Folic acid is important for metabolic pathways, and a disruption in folate intake leads to changes in embryonic development. Third is maternal diabetes. Increased glucose levels can be a primary or secondary teratogen, depending on how it changes gene expressions. And the fourth is teratogens such as valproic acid or carbamazepine. Both are anticonvulsants. Valproic acid has free radical byproducts that can damage tissues of the embryo, and both have an adverse effect on folate metabolism. Diagnosis during the pregnancy. When routine ultrasounds are performed, usually spina bifida can be diagnosed this way. There's also the maternal serum alpha-fetoprotein testing, which is a blood test performed on the mother, and if there's a high amount of AFP present, that indicates spina bifida. Positive findings in those previous tests leads to amniocentesis or a detailed sonography being performed. They will take a sample of the amniotic fluid and test for the acetylcholine esterase and alpha-fetoprotein levels. If they're higher than average, that indicates spina bifida. There is also chromosomal abnormalities that are evaluated by examining fetal karyotype. Diagnosis after birth. Sometimes spina bifida stays undiagnosed until after birth. This is in cases when mothers have received limited to zero prenatal care or have unclear ultrasound pictures. So the doctor can perform image scans on the baby and analyze the spine. Treatments in utero. So surgery can be performed on the fetus if spina bifida is detected during the pregnancy. The pros to this is that it can decrease the amount and severity of spinal defects like hindbrain herniation. The cons is that it can be dangerous to the child and the mother. There's an increased fatality rate during the surgery, and there's the increased risk of premature birth, and it can also cause maternal complications like pulmonary edema or hemorrhagic complications at birth. Treatments post-birth. So surgery can also be performed within the first 24 to 48 hours after birth. The pros is that this is safer to perform. There's less risk associated with the surgery. The cons is that due to fetal development fully occurring and the spina bifida developing undisturbed, the spinal damage is usually worse and the chances of improving the child's mental and physical development are decreased. So when older, these children may need walking or mobility aids, braces, wheelchairs. As spina bifida is a condition affecting movement, consistent physical activity is extremely important. CDC recommends 60 minutes of physical activity a day, whether this is achieved through walking or rolling through the neighborhood, joining play with other children, joining sports teams or other forms of physical activity with kids with disabilities or without disabilities, many options. And for cures and prevention, there's no definitive cure currently available. There are some forms of prevention though. The first is folic acid supplementation during the periconceptional period, which is really important because it can prevent up to 70% of cases of spina bifida. The exact mechanism of prevention is unknown. It's just thought to be connected to the genes that regulate folate transport and metabolism. So for any woman that has the possibility of becoming pregnant, it is recommended they consume 400 micrograms of folic acid a day. Another prevention aspect is prevent overheating. So that means limiting visitation to saunas, hot tubs, etc. And the last thing is being able to communicate prescription drug usage or supplementation to the doctor.
Moving forward here, I want to touch a little bit more on spina bifida and how it affects the body. So spina bifida can present itself in varying degrees of severity depending on the location or size of the lesion along the spine. So we can see impairments related to cognition, motor function, sensory function, as well as neurogenic bowel and bladder. Now, in more severe cases, we can see impairments including paraplegia and orthopedic problems such as scoliosis, club feet, and hip problems. Now, in the past few years, we've seen survival rates increasing within the population of spina bifida thanks to technological advancements. So it's been highlighted that managing these impairments and their symptoms along with their comorbidities really stand out as a key factor when considering quality of life as they age. Now, how does this relate back to physical activity? Well, studies have shown that participation in physical activity in the population of those with spina bifida is much lower in comparison to those of their able-bodied peers. It's also been shown that those with spina bifida exhibit higher rates of obesity, reduced aerobic capacity, lower functional ambulation, as well as lower muscle strength. Now, all this puts them at a high risk of developing comorbidities such as cardiometabolic disease. So staying physically active within this population is greatly important as it helps to manage these symptoms as well as their psychosocial health. Now, due to this being a congenital disorder, participation in physical activity programs starting at a young age has been highlighted within literature as being really important to instill that strong sense of physical literacy as they move and age forward in their lives. But with that being said, a lot of the literature and research is focused on youth and adolescents, and a lot of these programs are also developed for youth and adolescents. So there's currently a huge lack of programs to assist those over the age of 50 with spina bifida.
Spina bifida and physical activity. The severity and the type of spina bifida individuals may have dictates the variety and the amount of physical activity and recreation they can be involved in. Parents of individuals that have spina bifida felt that there are barriers in participation in recreation and sport, as they felt that there wasn't a variety of activities for children to safely participate in, or have had difficulties finding activities that were suitable for the whole family. The lack of safe opportunities for these individuals in the world of sport and physical activity leads to difficulty trying to balance the needs of these individuals who have spina bifida with the needs of non-affected family members, which causes stress and double the rate of psychological health-related problems that is expected for that specific population. The lack of opportunities for participation often makes them feel like physical activity is not as important to them compared to other populations. Often, this results in an inactive lifestyle consisting of lower aerobic capacity, decreased level of daily physical activity, higher prevalence of obesity, decreased muscle strength and endurance, and an increase in body fat and a reduction in stamina, which could potentially limit functional independence and lower health related quality of life in specifically adults with spina bifida.
All right, so now we'll move on to exercise guidelines for people with spina bifida. So adults should be increasing or maintaining their activity levels as consistent with guidelines outlined by National Activity Standards. So in Canada here, that's CSEP. And CSEP outlines that adults should be engaging in 150 minutes per week of moderate to vigorous intensity aerobic exercise, as well as muscle strengthening activities and bone strengthening activities at least 2 times a week. And specifically for people with spina bifida, they should be stretching at least 3 to 4 times a week just to make sure that they're not overexerting themselves or working out too much that they could get injured. Exercise training has been proven to improve cardiorespiratory endurance and muscle strength in individuals with spina bifida, which is really important because those are the 2 systems that are most affected by their disability. And that's going to help enhance their overall functioning and help them with their activities of daily living. Additionally, just like with any individual, it's really important that people with spina bifida reduce sedentary time and they incorporate a variety of activities and different movement skills. And again, just to reiterate, avoiding overexertion or injury. For children, guidelines are more or less the same. When they're very young, so around 0 to 5 years old, it's really important that the child is educated on their condition, the parents are educated, the guardians are educated, and as well they develop a healthcare team, including PTs, OTs, and any sort of other healthcare practitioner. So around 11 months old, it's really important to assess their motor function to determine what interventions are appropriate, so potentially if there are treatment options for them, or what exercise would be good for them. Educating parents and guardians about adapted options that they can enroll their child in, and also how to encourage their child to be physically active, because it's really important once the child gets around 1 to 2 years old that they see their parents and guardians modeling physical activity, because it's going to encourage them to want to be physically active and see it as something that's enjoyable and fun and not something that's meant to be punishment or something that's used to fix them. And again, like learning more about those adapted options so that when they're around 3 to 5 years old, they can actually start participating in more physical activity and more game type scenarios. So, and obviously working with their physical and occupational therapists to ensure that they're being safe, if they need specific equipment to make sure that it's adapted for them. And so that can include adaptations for children with shunts or mobility adaptations. Yeah.
All right, so now we're getting into some older children with spina bifida, and the guidelines for ages 6 to 17 years of age are pretty similar. Now, they should be engaging in 60 minutes of physical activity or more each day, and aerobic activity should make up most of the child's activity. Now, vigorous intensity aerobic activity should be done at least 3 days per week, as well as muscle strengthening activities and bone strengthening activities. Where it differs is that as the kids get into this older age group, they start to develop more independence within their exercise routine. This includes them developing their own physical activity goals and working with their healthcare team themselves to address and minimize their individual risks associated with spina bifida. And that brings us into precautions. Now, one main thing with individuals that have spina bifida is a latex allergy. So it's important that when they're exercising, make sure that they have latex-free exercise bands. Another really important thing to consider is pressure sores. So especially if they're playing a lot of wheelchair sports or are in a wheelchair, making sure that they do some wheelchair push-ups and frequent repositioning, as well as having good back support and posture, are really important. The next precaution is high fracture risk. Now, this is because they have an increased chance of osteoporosis since they're not moving around as much. And another thing is that a lot of people with spina bifida have balance issues since they may not be walking too much. So that could also increase their chance of falling and therefore fracture risk. Now, another precaution is if they have a shunt. So if they have a shunt, they should be avoiding any physical activity that is contact, so contact sports like football and rolling activities and even jumping from heights should be avoided. Some other things or precautions to keep in mind are muscle spasticity, thermoregulation, because they may not have normal sensations, and bladder incontinence, so making sure they go to the bathroom before exercising. But yeah, thank you for listening and watching to our presentation. We hope you have a better idea of what spina bifida is.
Thank you. Bye.